All right, if you're a medical student, you've definitely heard of oxytocin. It's pretty much everywhere in obstetrics. But do you really get why it's both a lifesaver and, at the same time, a high-alert medication? In this explainer, we're going to cut right through all the noise and give you the high-yield concepts you absolutely need for your exams and your rotations. So let's dive right in.
So what's the deal with oxytocin? Is it this miracle drug that helps with safe deliveries? Or is it a major risk that could actually lead to disaster? Well, the truth is, it's both. It's one of the most common drugs you'll see in a labor ward, but it's also officially classified as a high-alert medication. And understanding that paradox, that double-edged sword, is the absolute key to using it safely.
Okay, first things first. Before we can really get into oxytocin, we need to understand the family of drugs it belongs to.
Simply put, oxytocics are any drugs that get the uterine muscles to contract. Now, there are a few of them, like ergot derivatives and prostaglandins, but the main one, the prototype, and the one we're going to focus on is oxytocin. It's the one you're going to see and use the most in your clinical practice, for sure.
Right, Section 2, the pharmacology. To use any drug safely, you've got to understand how it works. So let's break down the core pharmacology of oxytocin, because honestly, this is the foundation for everything else we do with it.
Let's just look at the key facts here. So oxytocin is a nonapeptide, which just means it's a small protein made of 9 amino acids, and it's made up in the hypothalamus. But the most critical detail for us, clinically speaking, is right here. Its half-life is only 3 to 4 minutes. Now, just think about what that really means. If your patient's contractions are suddenly way too strong or the baby starts showing signs of distress, you can just stop the infusion. And within about 20 minutes, the drug's effect is pretty much gone. This super short half-life is our built-in safety switch. It's incredibly important.
So why is oxytocin so incredibly effective right when we need it, during labor? Well, the magic is all in the receptors. See, for most of the pregnancy, the uterus is kind of just ignoring it. But as labor gets closer, something amazing happens. The number of oxytocin receptors on the uterine muscle, the myometrium, explodes. We're talking 100 to 200-fold increase. This massive upregulation is the key. It makes the uterus hyper-responsive right at the perfect time.
Okay, so how does that binding actually lead to a powerful contraction? Well, it's basically a chain reaction, and it's all about calcium. First, oxytocin latches onto its receptor. This opens up these little gates, the voltage-mediated calcium channels, and calcium starts to flow into the muscle cell. Now, that initial rush of calcium then triggers the release of even more calcium from the cell's internal stores. All this free-floating calcium finally flicks the switch on the contractile proteins, actin and myosin, and that causes the muscle to squeeze. This whole cascade is what gives us those strong, coordinated uterine contractions.
All right, Section 3. Now that we've got the pharmacology down, let's look at how we actually apply this stuff in real-world clinical situations.
A really easy way to think about oxytocin's uses is to break it down into 3 time periods. First, during pregnancy itself, we might use it to induce labor when it's time or to help manage a miscarriage. Second, during labor, its main job is often to augment or just strengthen contractions if labor is slowing down. That's a condition we call uterine inertia. And finally, after the baby is born, in the puerperium, it's absolutely critical for preventing and controlling postpartum hemorrhage by making sure that uterus clamps down nice and firm.
But oxytocin isn't just for treatment. We can also use it for diagnosis. The contraction stress test, or CST, is all about answering the question, how is this baby going to handle the stress of labor? We give a tiny bit of oxytocin to cause mild contractions, and then we watch the fetal heart rate to see how it responds. The oxytocin sensitivity test, or OST, answers a totally different question. Is this uterus even ready to be induced? It helps us predict if a full induction is likely to work.
Section 4. Dangers and safety. Okay, we've talked about all the good things. Now we have to talk about the risks. Because oxytocin is a high-alert medication, understanding the dangers and why we have to monitor so carefully, well, it's just non-negotiable. The single most common and, frankly, most feared complication of using oxytocin is something called uterine hyperstimulation. This is the big one we're always on the lookout for and trying to prevent.
So what exactly is hyperstimulation? It just means the uterus is contracting way too much. And this can happen in a couple of ways. First, you can have hypertonia, where the contractions are just too long, or the uterus doesn't get a chance to fully relax in between. Or you can have polysystole, where the contractions are coming too frequently. The classic definition is more than 5 in a 10-minute window. Either way, the fundamental problem is the same. All that constant squeezing reduces blood flow to the placenta, and that can lead to fetal distress.
Okay, here's a classic scenario for you. Definitely something you'd see on an exam. You have a patient on a high-dose oxytocin infusion, and she starts to get confused and drowsy. What serious side effect should immediately pop into your head? Think about the hormone's chemical structure for a hint.
Did you get it? The answer is water intoxication. And this is a super high yield point. Here's why. Oxytocin is structurally very similar to antidiuretic hormone, or ADH. So at high infusion rates, it can actually start acting like ADH. This makes the kidneys hold on to water, which leads to the sodium in the blood getting diluted. We call that dilutional hyponatremia. And that's what causes the neurological symptoms like confusion and, in really severe cases, even convulsions and coma.
Now, besides hyperstimulation and water intoxication, there are 3 other big dangers you've got to know. First, uterine rupture. This is a catastrophic event, and the risk is much higher in patients who've had previous C-sections. Second, a sudden deep drop in blood pressure, hypotension. This can happen if you give the drug as a fast IV push, which is exactly why it must always be given as a controlled infusion. And third, fetal distress, which, as we said, is the direct result of that hyperstimulation cutting off blood flow through the placenta.
Okay, Section 5, Key Exam Takeaways. We have covered a lot, so now let's just boil it all down to the absolute must-know points for your exams.
For pharmacology, just burn these 3 points into your brain. 1, its short half-life is our safety switch. 2, it causes powerful, coordinated contractions because it mobilizes calcium. And 3, it works so well during labor because of that massive increase in myomatrial receptors.
And clinically, remember its 3 main jobs: starting labor, speeding up slow labor, and stopping postpartum hemorrhage. The biggest dangers to watch for are uterine hyperstimulation and rupture. And please don't forget that rare but classic exam question about water intoxication, all because of its ADH-like effect at those high doses.
So to wrap it all up, it really comes down to balance. Oxytocin is an incredibly powerful, absolutely essential tool in modern obstetrics. But it demands our respect. It requires careful patient selection and constant, vigilant monitoring. The key to using it safely is to always be weighing the benefits against the potential risks for both mom and baby.
And I'll leave you with one final question to think about. What is the single most vital sign to monitor during an oxytocin infusion? The answer, of course, isn't just one thing. It's the relationship between the uterine contractions and the fetal heart rate. Watching that relationship, that back and forth, that's the absolute key to using this double-edged sword safely.